Hello. You or someone you are caring for is going home with a central line. You have already been provided with written information, and now we will be reviewing the general care for central lines.
This includes infection prevention, dressing and cap changes, flushing the central line, activities you can and cannot do, potential complications, when to call for help, or how to use resources and contact your healthcare providers.
A nurse will make sure that you know exactly how to care for your central line and what supplies are needed before you go home. Be sure to ask questions if there's anything you do not clearly understand.
Often a home care nurse will come to your home to care for your central line or to continue teaching you how to care for your line.
Let's start with the most important aspect of line care, infection prevention. Your healthcare providers have already talked to you about the potential risk of getting an infection in your blood through your central line. Therefore, it is very important to make sure that you and anyone who uses your central line follows infection prevention care.
The most important step in infection prevention is hand hygiene. Anyone who uses your catheter must first wash their hands. Also, anytime someone uses your line, they need to scrub the cap for 15 seconds with an alcohol wipe.
These are the two most important steps. There are other steps to prevent an infection that we will review.
It is important to avoid activities that put you at risk for getting the dressing wet, dirty, or pulled off. The dressing on your central line needs to be changed every 7 days or sooner if it becomes wet or dirty.
If you need to shower, make sure the dressing is covered so it does not get wet. There are a variety of products available for this. Sometimes plain plastic wrap with tape works well. Be sure to avoid spraying water directly on the area, as it may not be perfectly sealed. If your central line dressing does get wet, it will need to be changed at that time.
When you have a central line, you cannot go swimming. There is one exception. That is if you have an implanted port and it is not accessed with a needle. Speak to your healthcare provider if you have any questions about swimming with your catheter.
The central line should be taped under your clothing and always above the waist. Caregivers of small children should make sure that the child's central line is not in contact with the diaper.
If your dressing is loose or dirty, or after 7 days, your dressing should be changed. It can be changed by your healthcare provider. If you have been taught to change it by your nurse or doctor, you may change it as well. It may take several times practicing with the nurse before you can change your dressing alone.
Your central line needs to be flushed after each time it's used for a medication, infusion, or blood draw. When your tunneled central line is not being used, it needs to be flushed every day. When implanted ports are not being used, they need to be flushed every month. The access caps of the line need to be changed every 4 days.
While a central line is necessary for your care, it can increase your risk for an infection. To minimize that risk, we will use a vein in your arm or your hand to draw blood whenever possible. This is the safest way to prevent infection. Each time the central line is used, there is a chance for infection to take place.
It is important not to get air into your central line. Always make sure that the clamps on your central line are closed and that the access caps are on tight. You will be taught what to do if a cap falls off. Also, always keep a special clamp with you in case the central line breaks. The nurse will give the clamp to you before you go home.
Your physician or nurse will tell you what types of physical activities are okay for you to resume. Contact sports are usually prohibited because of the potential for a blow to the chest or the line accidentally getting pulled out. As we mentioned earlier, you should not swim with the central line unless it is an implanted port that is not currently accessed.
Now let's go over some possible problems you might see at home. The signs of infection and problems are similar for all types of central lines. If you have any sign of infection or central line problem, call your doctor immediately.
Signs of infection can include redness, tenderness, warmth, or drainage around the catheter site, a fever of 100.5 or greater, or chills. Other signs of a problem can be swelling of the face, neck, chest, or arm on the same side as your central line, the inability to flush or a resistance when flushing the central line, and leakage of blood or fluid at the catheter site or the cap.
There are also some complications that require you to call for immediate help. Although these do not happen often, it is important for you to know about them and whom to call.
If you develop sudden chest, neck, or shoulder pain, coughing, or difficulty breathing, make sure your central line is clamped. Lie on your left side with your head down and have your care provider call 911. This may be an indication that there is a clot or air in your lung.
Another complication that needs immediate attention is if your catheter becomes accidentally removed. However, this does not happen often. If it does, you need to apply pressure to the site with a gauze pad or a clean washcloth. Call your doctor immediately.
If your catheter has a hole or break in it, use the special clamp you were given. Clamp your line between the hole and where the catheter exits your body. Do not use the line and call your doctor. It is important for you to be careful with your central line, to protect it, and to avoid activities that could possibly pull or break your line.
We have just given you a lot of information, and you will receive written instructions before you leave the hospital. You will also receive a passbook that tells you when and whom to call. Please call the doctor listed anytime you have any questions about your central line.
The passbook also has important instructions for other healthcare providers. Be sure to bring it with you anytime you go to your doctor's appointment or if you go to the hospital.
Remember, your healthcare team is always available to answer any questions you may have while you are home with your central line. If you have any questions about caring for your line or the content of this video, please ask your nurse or doctor. Thank you.